It is often said that men ignore their health, and that is why this month is dedicated to spreading awareness about prostate cancer, which is the second leading cause of cancer death. There is a new study out now that could help in the fight against that deadly disease. Joining us now is Dr. Edward Schaeffer, the chair of the Department of Urology at Northwestern Medicine. Doctor, thank you for being with us.
Thank you for having me.
I want to begin with the personal reason that this topic is so important to you, if you don't mind sharing.
Yeah, prostate cancer is very common. It's the leading cause of cancer diagnosis in men, and I have a very strong family history of prostate cancer. My grandfather had prostate cancer and passed from it, and that was always a driver for myself to be interested in this field.
What are the signs that people should be looking for?
Well, prostate cancer is unique among many cancers in that we often will pick it up with a blood test, and the blood test can detect prostate cancers that are early before any signs or symptoms develop. So actually about 95 to 98% of prostate cancers are picked up without any evidence that something's wrong with the person. And that's sometimes upsetting for men, but actually I view it as a positive in that things are still well under control for most of those individuals, whereas sometimes if you present at much later stages with symptoms, the cancer may be less curable.
Right. Now, the numbers are that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That's eyebrow raising. And I know there's a lot of talk about men not wanting to go and get screened, which is so crucial. Other than talking about it, how can we get men into the doctor's office to keep tabs on their health?
Yeah, it's definitely an issue that we struggle with more in men than in women. But I would say we really encourage people to not be afraid to engage with their physicians. There's lots of opportunities to receive life-extending care from a team of physicians. That would be urologists, but also general internists who can manage and monitor heart health and screen for colon cancer and help screen for prostate cancer. So we definitely encourage men to not be afraid to reach out to their physicians to establish longitudinal care and then begin the discussions about what things they should be looking out for. Obviously, heart disease is the leading cause of death in men, and cancers are not that far behind. And so we want men to be able to be open with their doctors about screening for prostate cancer as well as other cancers such as colon cancer.
Now, Doctor, we wanted to talk to you about being the lead investigator on this new study regarding the alternative approach to detecting prostate cancer. What makes your findings new and different and hopefully helpful for future patients?
Yeah, so we screen for prostate cancer with a blood test. It's called the PSA blood test. If that test is abnormal or elevated, we often confirm that with an MRI image of the prostate. Historically, we would then do a biopsy to confirm a diagnosis of cancer with a procedure that would or could expose a man to increased risk of infection. So we developed an alternate technique and then studied it in 10 centers throughout the US to determine if that alternate technique, which is percutaneous, the biopsy needle just goes through the skin itself and has a very limited or no risk of infection, could detect cancers equally well with this better safety profile. And we studied that, and we're excited to report that we're excited to report that the findings of the study were positive in that we now know men can receive a prostate biopsy with almost no risk of infection, yet not compromise their cancer detection.
Wow. Okay, the future of care. We're glad that you're a part of it. Dr. Edward Schaeffer with Northwestern Medicine. Thank you for your time.